Good afternoon, and thank you for joining us. My name is Tina Tebow. I'm the Director of Media Relations for the province of Nova Scotia, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Jeff McCullen, Minister of Business, the Honourable Steve McNeil, Premier of the province of Nova Scotia, and again, Dr. Robert Strang, the Chief Medical Officer of Health. Again, today we will be taking questions from reporters on the phone. The Premier will go ahead and start now. Go ahead.
Thank you, Tina, and welcome to Minister McClellan, who is with us. He'll have a bit to say on supports that we want to provide to businesses in Nova Scotia. First, we'll go to Dr. Strang, who will talk about the one additional case of COVID-19 here in Nova Scotia.
Thank you, Premier. And yes, today we have one additional case. Like other cases, it is related to travel outside of the country. That brings the total to 15 cases of COVID-19 in Nova Scotia. 5 now are confirmed by the National Lab, and the other 10 are presumptive based on testing here in the province. Those cases are located in communities across the province. The age ranges we're dealing with are people from in their 20s to their 70s. As I said yesterday, we had one case of a hospitalization. Everybody else remains recovering at home under self-isolation. In all of our cases, public health has done extensive contact tracing. So we identify people who have been in close contact, and any of those individuals are then put on self-isolation for 14 days. They monitor their health, and public health checks in with them on a daily basis. We continue to test significant numbers of people. To date, we've now had almost 1,550 negative test results. So as the numbers of cases, I fully expect they're going to continue to happen and will rise. We're all likely to see community spread within Nova Scotia, and we're actively working now to expand our surveillance system to detect any such spread. I just want to touch bases on a couple of other issues that we've talked about throughout the week. One is around N95 masks. We know that the virus that causes COVID-19 is a respiratory virus spread by what we call droplet spread. The science and the global experience with COVID-19 tells us that regular routine care of patients with this type of virus can be safely and appropriately done with personal protective equipment consisting of surgical mask, eye protection, or goggles, gowns, and gloves. This is absolutely consistent with the World Health Organization and national recommendations for infection control for COVID-19. For this type of respiratory virus spread by droplets, N95 respirators are only necessary when conducting specific, what we call in medical language, aerosol-generating medical procedures. The most common one when we'd have to put a breathing tube down somebody's throat. With this pandemic, there is an increasing global demand for masks and equipment. And it's very important that the use of all masks, including N95s, is only done when appropriate and necessary. We are working with our federal and provincial territorial partners to secure additional supplies of personal protective equipment, and there's a bulk order for that actually going in today. And we're also reaching out to other industry partners outside the healthcare sector, such as the construction industry, for any additional supplies of things like N95 masks that they might not be using at this time. I'd just like to shift quickly to 811. 811 continues to experience high call volumes, and we're working very hard to build capacity and respond as quickly as we can. But it's important that I want to remind Nova Scotians that we need to use 811 only when necessary. So if you're just looking for basic information on COVID-19, please go to the government website, novascotia.ca/coronavirus. If you're concerned you may have symptoms that could be COVID-19, use the 811 online self-assessment tool first. It will give you some direction. And then if you screen in through the online tool, then you can call 811 directly. They'll do a further assessment, and as necessary, will direct you to one of a number of COVID-19 assessment sites that have been opened up by NSHA around the province. the other piece is for people who have other health issues that are not related to COVID-19, 811 is still there for you, and you need to call 811 if you think you need some direction about what kind of care you might need. I'll hand it now back to the Premier.
Thank you, Dr. Strang, and on behalf of all Nova Scotians, let me just say thanks for the tremendous work that you are doing, and please pass on to your wife and children our appreciation for their sacrifice and the work that you're doing on behalf of all of us.
I appreciate it. If I can say, I said to you last night, I'm only the face of this. There are hundreds and hundreds of healthcare workers and public health folks working 7 days a week on this right now. So thank you.
And I want to echo the doctor's comments and offer my thanks to many of the frontline healthcare workers, home care workers, pharmacists, who across the province are responding to Nova Scotians and not only for COVID-19 but for other health challenges in a very stressful environment. And we want to say thank you for your continued professionalism and say thank you to your families. I know your loved ones are sending you out the door in the morning to go to work with a higher level of anxiety than would have been a few weeks ago. So on behalf of all of you, on behalf of us to all of you, just let me say thank you, and to all Nova Scotians who have been working diligently to take care of one another. It is critical that we continue to think about our neighbors, think about our family and friends, know of someone who is in our communities that may not, quite frankly, be living alone, may not have family around, to pick up the phone, call them, reach out to them. That even though you may not have physical contact, any contact and point of contact that you make to a neighbor is important. And we want to just say, continue what you've been doing. We can't become complacent. As Dr. Strang has said many times, we're at the front end of this. This is coming to our province at a greater rate. And we need to make sure we continue to do the due diligence that we've been doing, and caring for one another is probably as important as any medical intervention we're going to make. That contact of kindness really does matter and goes a long ways. I also want to say to the business community that is out there, we recognize these challenges have created a lot of pressure on you. Whether it is a small or medium or large size business, we want to tell you that we are here and working with you and thinking with you. We're working with our national partners. We appreciate what has happened at the national level with the national government and our national banks when it comes to individual mortgages. We need them to take it a step further. We need them to look at commercial loans that are out there. Our business industry, our business community needs your support. We shut down really retail in this province. We shut down the restaurant sectors. All of those are sitting there, small business owners who have rents to pay, to people who have corporate loans. We need those corporate loans to be deferred for a period of time so the landlord can defer the rents to those small businesses. It will be critical in order to keep them in business as we go forward. So we want to continue to work as a federation across the federation with our partners, with all provinces and national government, and work with the national banks to ensure that we as a country come through this, but at the same time we will have the ability to respond economically in a very short order when public health gives us the ability to begin to allow our economy to move forward. So we're going to continue to fight on behalf of Nova Scotia companies, but indeed on behalf of the Federation, that we provide some support on those commercial loans that can allow the supply chain to be relaxed a little bit and take pressure off our small business community who we've literally closed down for public health reasons. And today we're here with the Minister of Business, so there are some things that we specifically can do as a province. And I want to thank Minister McClelland and his team at Department of Business for their tremendous work. And I now will turn it over to him.
Thank you, Stephen. Good afternoon. I've put together a rapid response team to begin identifying ways to support our businesses during this time of uncertainty. We have been working with the Chambers of Commerce, Crown corporations, our provincial and municipal partners, and our tourism stakeholders to better understand the needs of small and medium-sized businesses. Our focus here today is on those most impacted. Today, we are announcing $161 million to immediately address cash flow and access to credit for Nova Scotia small and medium-sized enterprises. Effective immediately, we will defer payments and interest for government loans, including those under the Jobs Fund, the Municipal Finance Corporation, and Housing Nova Scotia. Government will defer business-related fees until June 30th. A list of those fees will be posted online in coming days. Worker compensation premiums will also be deferred, keeping $60 million in the hands of Nova Scotia businesses as well. Loan payments under the Small Business Loan Guarantee Program, administered through the Nova Scotia credit unions, will also be deferred until June 30th. We are enhancing that very program, making it easier for small businesses to access credit up to $500,000. For those who might not otherwise qualify for a loan, government will guarantee the first $100,000. For those employees and small businesses who are now working from home, we want you to have the internet access that you need. We've already committed $46 million to expand internet access across the province. Today, we are announcing an extra $15 million to incent providers to speed up projects and have them complete as soon as possible. Increased internet coverage in rural areas will help more businesses tap into e-commerce in a time of social distancing and allow people to work more easily from home. It will also support better access to e-health. As I stated off the top, we are focusing our first wave of supports on those most immediately impacted. We will continue to work closely with the business and social enterprise communities across Nova Scotia, and of course, we are prepared to take further action. Back to you, Premier.
Thank you, Minister. In addition to those announcements the Minister made, next week we will be laying out an aggressive package of capital projects that are the responsibility of government, and we'll have more to say about that next Monday. As well today, in addition to what the Minister just announced, to our students who are concerned about making payments to their student loan, as of March 30th, we will suspend Nova Scotia student loan payments for 6 months until September 30th. Students do not have to apply. That will be automatic, become effective on March 30th. Effective immediately, all loans through the Fishery and Farm Loan Boards will be deferred until June 30th. I've instructed a special prompt payment process for small businesses who do work on behalf of government. This has already resulted in 5-day turnarounds for payments to small business, not the traditional 30 days. This new system will put cash in the hands of our small business operators and their employees. With regards to our key industry, fishing, farming, and construction, I've heard from you, and I know the anxiety that many of you are feeling. Planting season is about to start, fisheries is about to open, and construction projects across our province are underway. To those industries, we are working closely with public health officials to ensure that you can operate safely. Your sector is an important part of our economy. We want them to continue to provide employment and keep the economy moving while public health advice, including social distances, is followed. We all need to do our part to prevent the spread of this virus. But it's important that parts of our economy that can operate need to continue to operate to provide the support for families across our province. And we can do so in some of our sectors by following the advice from public health. So again, to Dr. Strang.
Thank you, Premier. So it's important to remember where this is the end of week 1. We're into this for many weeks. There is going to be more spread in Nova Scotia, but the things that we've been talking about all week, so the importance of everybody, including people in the industries we just talked about, taking the personal preventive measures. How do we support good hand washing, social distancing, staying home if you're sick, as well as complying with all the measures we've done to prevent groups of people gathering together. That's all about preventing the spread of the disease. How much this affects Nova Scotia and how much we were able to protect those who are most vulnerable, seniors, people with immune compromise conditions, and how much we are able to sustain our healthcare system, it really all depends on how much we take together all these actions and how we support each other so we can all be as preventive as possible and remain as healthy as possible.
Thank you, Dr. Strang. We'll now go to the phone lines. Again, just a reminder, keep your phones on mute. I will take one question and one follow-up from each outlet. We have 15 people on the phone who have questions. We may not get up to all your questions today. We'll do our best. We have approximately 25 minutes. We will start with Jean Laroche from CBC. Go ahead, Jean.
Hi, this is for the Premier. I understand what you're doing for all businesses who have loans from the government or who deal with the government. What about everyone else? Number of cafes, number of shops that you have ordered closed are really hurting, and they have rent due.
So as part of what Mr. McClellan just announced with the credit union loan, that's available to all those small businesses. We would underwrite the first 100,000 for security for the credit union. At the same time, opening when I started, we need a national program when it comes to the commercial lending in this country. We have a lot of major developers who have property that they're renting out to, whether it is to a cafe or a restaurant, that payments due. We need those deferred, and we need those developers to pass that deferral on down to allow that rent that is due to be deferred as well. And we'll find our way through this, but it will require a national support from the federal government and our national banks. And I can't stress this enough. It will be critical that they continue to provide this deferral on some of these major loans to see our way through this. These are viable businesses. These are viable entities, but they need our help to get through the next, till at least the end of June. But it will require a national program to make that happen.
Do you have a follow-up question, Jean?
So I take from that, Premier, there's nothing that your government can do to force landlords to defer rent.
Well, the landlord, Jean, also has a mortgage to pay, has a commercial line of credit to pay. That's the challenge we're faced with. That's what we're saying. And we're working with the national government to ensure that they work on a national level, because it's not unique to commercial loans in Nova Scotia. It is across the country where we need to have a program that allows us to defer that commercial payment, and then that landlord passes it down to the people who are renting from them. That's how this will work. And I believe these businesses are viable. We just need a program that gets us through the next 90 days.
Next, we'll go to Todd Battis from CTV National. Go ahead, Todd.
Hi, this is for Dr. Strain. The Premier mentioned earlier that there are challenges to health care. Doctor, we've received some calls from cancer patients who are newly diagnosed who are concerned that they're unable to get in to see specialists or to begin any kind of treatment. I'm wondering if you're aware of this, and if so, what you might be able to tell them.
I'm not aware of those specific concerns, but we did have the CEO, Dr. Brendan Carr from the Health Authority, on one of these events earlier this week. And cancer treatment, cancer surgery, cancer treatment, and investigation is one of the areas that they are focusing on and preserving that, while they do a whole bunch of other things to build capacity in the healthcare system to deal with COVID-19.
Do you have a follow-up, Todd?
I guess it would just be anyone who is newly diagnosed and concerned that they're not on a schedule. Where would you point them?
I think you'd have to take that question for more details to the Nova Scotia Health Authority.
Next, we'll go to Cassandra Nadeau-Lamarche from Radio-Canada.
Yes, this is a question for Premier McNeil. So now that the school March break is almost over, have you figured out a little bit more details as to how the next weeks are going to go for school-aged children?
Well, we've canceled school for the next 2 weeks. Dr. Strang and I in Public Health will review that as early as next week as we enter into that 2-week closure. And then through the support of Public Health, they'll make recommendations on what we do.
Do you have a follow-up, Cassandra?
Just regarding daycares, so New Brunswick has some daycares for essential services workers that are open. Is that something that could be happening here too?
Well, we have now here in the province where a number of, you're allowed to look after 6 children in a community without going through the process of a daycare environment. We know that's happening, and we'll continue to support that. But if there are initiatives that are required through people in the essential services, we'll do what we can to help them for sure.
Thank you for that question. Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, for Dr. Strang, I'm just trying to get a better handle on where we are with supplies. I think you said the other day that we have plenty of supplies, at least for the short term. At what point might we run out, or what are the most essential things that we need? And secondly, this is to the Premier on ventilators. I know the ask is into the federal government. Have we actually looked into, on our own, any requests to the private sector in terms of that? I know PEI has also done that.
On the supplies, we can only speculate to your question about when we might run out. There's been a lot of work done to anticipate what the need will likely be and built in a significant buffer on top of that. And we're working through a federal, provincial, territorial procurement process to procure what's necessary based on those estimations.
And to your question, we have worked with our provincial partners across the country to look at options about how we can have a made in Canada solution. You would have heard the Prime Minister talking today about retooling some auto park manufacturers in Ontario very quickly to build ventilators, but also provide in other potential healthcare equipment that we're looking for. So we're working with them, and we've had some private entities in here bring us solutions about potentially being able to help when it comes to the supply of certain types of, whether sanitizer or other product in the healthcare system.
Do you have a follow-up question, Keith?
Yes, just for Dr. Strang. I wonder what the advice has been to businesses that are remaining open. We got word today that Sobeys is taking steps like putting up plexiglass and having their workers wash their hands every 15 minutes. I've heard personal complaints from people who are working at banks that they're still dealing with people coming in. What's your advice or directive to these kinds of businesses that are staying open?
So we've given broad public health advice that we've said there's a whole range of businesses that we have closed down because that's where large numbers of people can gather. There's lots and lots of other businesses that we've said, as long as you can adhere to the public health principles of supporting personal protective measures like hand washing, maintaining the social distance of 6 feet, and limiting the numbers below 50, each business then has to figure out, they know their own environment, their own physical layout best, and how they operationalize that. So we're leaving it to those businesses to whether they can, if they can remain open by adhering to those public health principles thoroughly, then we believe they can remain open safely. That's where we're at today. If things change and we get a significant amount of community spread, we're fully prepared to revisit that and see, do we have to become more restrictive. But as you heard from the Premier earlier, this is about finding the appropriate balance. What do we need to do to minimize the spread of the disease, but also we need to do things that minimize economic and social disruption. So we're continually looking at that balance, and we will adjust as necessary depending on how significant the spread of COVID becomes.
Next, we'll go to Frank Campbell from the Chronicle Herald. Go ahead, Frank. Frank, we'll come back to you. We'll go to Jesse Thomas from Global.
Thank you. I guess this is just a question around the numbers. We've seen 15 cases now since Sunday. And I guess my question is, are these social distancing measures working? Or is it too soon to tell? Or are we going to have to look at more excessive measures to help curb COVID-19 here?
So as I said earlier, we've been in this for just almost a week. Too early to tell. We've implemented these measures throughout the week. We're at the very beginning of this. over the next few weeks will really tell how successful our measures are being, and we're fully prepared to do, if we need to go stronger. In my discussions with the Premier, we'll make decisions on that, and that's always going to be driven by where we're at with the epidemiology of the disease. I come back to my previous comments, though, is that it's all within our hands collectively. That if we do all the things that we've been talking about all week, social distancing, personal protective measures, those together, if we all do them well, can have a significant reduction on the transmission of this disease within our province.
Do you have a follow-up, Jesse?
Yes, thank you. I do. Dr. Strang, you mentioned just off the top about increasing surveillance systems to detect such spread, and maybe that involves gathering more data. We've been asking for more numbers about people coming home, how many people have been in self-isolation. We don't have those numbers. I think people want to hear those numbers to understand, the severity of this. But I guess my question is what are these increases to the surveillance system? What does that entail?
Well, there's a group of people meeting this afternoon, so we're looking at those. What are our options about starting to do some testing of Nova Scotians who haven't traveled? We haven't landed on any final decisions there. We always have to do that in what's feasible. What can we do within the capacity within our lab? And the lab is rapidly working to almost double its capacity. So those are discussions that are happening now and throughout the weekend. And we'll when we're ready to make some or to roll that out, we can talk in more detail.
Thanks, Jesse. Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Hi there, this is a question for Dr. Strang. Yesterday you said you were expecting the cases to jump in the coming weeks with the end of March break. Is there a plan to increase testing capacity to cope with this?
So as I said, right now we're actively looking at doubling. Right now we can do about 250 tests a day in the lab. They're looking at things they can do around the different staffing models, using different types of procedures within the lab, and their target is we can get up to between 400 or 500 tests a day.
Do you have a follow-up, Lindsay?
Yes. Are you considering drive-through testing? Manitoba, BC, Quebec, Ontario now all have these options. Are we considering that here?
That's not off the table. It's in the mix of all the things we're looking at. We need as we continue to what is the appropriate approach to testing.
Thank you, Lindsay. Next, we'll try Frank Campbell again from the Chronicle Herald. Frank, are you there? Moving right along, we will go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, hi. Good afternoon. This question's for Dr. Strang, please. A lot of Cape Breton businesses have signs posted asking people, if possible, to pay by debit or credit card. We're wondering if this measure was recommended to the businesses in the communities, and if you are recommending that people also use this practice when possible.
We haven't made a specific recommendation on that. It's one of the areas we've left up to businesses. Whether you use a debit card or money, there's still hands involved. Knowing that there's probably more hands and money than a debit card, it's a reasonable idea. But there are people who are more in our community that don't have debit cards, and we have to make sure that everything we do, we're as much as possible, we're trying to make sure that parts of our communities aren't left behind and further marginalized and made more vulnerable by some of our measures.
Sharon, do you have a follow-up?
Well, yes, please. We're also noticing people are actually posting videos online washing their money. Will this help?
I can't. I don't have any information on whether washing your money or not is effective. It would entirely depend on how you wash it and what you're using to wash it.
Next, we'll go to Samuel Riches from the National Post. Go ahead.
Hi there. This question is for Dr. Strang.
Still there, Samuel?
Yeah, sorry, 1 second. Are you able to share the age of the one case in the hospital?
No, we can't disclose personal information on individual cases.
Do you have a follow-up, Samuel?
Yeah, I do. Can you speak a little to the need for young people to exercise caution right now and how it's not just the elderly who are susceptible?
Absolutely. Thanks for that question. So this disease, first and foremost, while we talk about who's at greatest risk, it can affect everybody. We're certainly seeing that there's some percentage of people even in their 20s that are getting severe disease when we look at other jurisdictions. Younger children, by and large, seem to get mild disease, although there is a small chance of more severe disease. But as you get older, the risk of severe disease becomes greater, but there's certainly young people and middle-aged people should not be complacent. The other thing is that I would encourage everybody, regardless of age, it's not just about protecting ourselves. Everything we do, hand washing, social distancing, we need to be especially protective. There are many people in our communities who, because of age or their underlying health issues, that are most vulnerable for severe disease. So we also have to think about how are we protecting them as well with all the things that we're talking about, whether it's hand washing, social distancing, staying away, maybe dropping off food on the doorstep, but to support them, but not coming in close contact.
We have approximately 10 minutes left. Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Hi. I think this would be for Dr. Strang. We're hearing from some people they had symptoms of COVID-19 in early February, so that would be a few weeks before the first Nova Scotia test. Is it possible that COVID-19 was actually present in our communities weeks before it was first diagnosed here?
I never say never. I was taught that in medical school, but it's highly unlikely. We also remember we're just still just on the downward slide, but we're still in flu season. Every winter we have a range of number of respiratory viruses, and the symptoms of COVID are really not much different from any other influenza or any other respiratory viruses. So it's much more likely that they had influenza or one of these other common seasonal respiratory viruses.
Do you have a follow-up, Natasha?
I do. Halifax Transit just announced this afternoon, about an hour ago, that they were reducing bus service by about 30% starting Monday. I'm wondering if there's any concern, perhaps the Premier can answer this, about essential workers or healthcare workers getting to hospitals next week.
At this point, no. We've seen tremendous support around communities when it comes to our healthcare workers and providers, community members offering to babysit, offering to provide support for kids that have been home for healthcare workers. But at this point, no. But we'll be keeping an eye on it to have a look and see if there's another role that we can play when it comes to ensuring that if the bus service interruption is causing a problem with that we can take steps.
Thank you, Natasha. Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hello. I'm not sure who this is directed at, but one of the largest private employers in the province is Michelin, and I understand that all three plants are up and running, and that's a 24-hour-a-day operation with far more than 50 people working in one location at a time. I'm wondering if you have any comments on that.
Minister McClellan.
Yeah, sure. Thanks, Tim. Very important and I think symbolic employer here. The Michelin footprint and the Michelin family have been here for generations in the province, and I had the opportunity to speak to their lead here in Nova Scotia, Andrew Much, this morning about what the impact is on their operations, the three that they have, and what they're going to do in terms of mitigation and in terms of their plan to move forward and continue as much production as possible. Obviously, everyone in the province, small businesses, corporations, all Nova Scotians are adhering to the warnings and the protocols by Dr. Strang and his team, as well as the Premier and what people have been advised to do. With respect to Michelin directly, they are obviously following all the health protocols while maintaining a certain amount of their operation in the near future. So Andrew and his team understand the impact of COVID-19 and how it's hitting our economy, hitting his workers and their families, and they're going to do the best to keep their employees whole, make sure that as many as possible can be a part of the continuing production, but at the same time follow the public safety messages first and foremost, and make sure we keep people safe.
Do you have a follow-up, Tim?
I do. In terms of deferment of loan payments and utility bills, which is happening with Nova Scotia Power and Halifax Water and other utilities. Isn't this just pushing the economic impact down the road a little bit, where people are going to be faced with double payments or large interest payments down the road, as opposed to right now? Is simply deferring these payments the best approach to this?
It is actually taking the pressure off now for a period of time, and what would allow for the lender as well as the person renting from them to negotiate longer terms to pay back what would be owed. It wouldn't be paid back on the first month of operation. It would be extended over a period of months, potential years. That would be something that would be worked out between the individual business who's renting from that corporation and, quite frankly, the terms that the bank would provide for the loans.
Thank you, Tim. Next, we'll go to Bill Martin from Six Rivers News.
Thank you. In recent press releases with each incident or increase in the number of cases in the province, you specifically had said there were no cases in northern Nova Scotia. Today's press release did not say that. Are we to assume that this is the first case today now in northern Nova Scotia?
No, I don't. I'm trying to take the attention off any specific part of the province. What we want people to understand is that we have cases in communities across the province, and we will continue to get more cases. I don't want to give one part of the province false reassurance that they don't need to do all the things we're asking them to. We have to be from Yarmouth to Amherst to all the way to Sydney. We all need to be prepared and working together.
Do you have a follow-up?
Yes, indeed. Thank you. Dr. Strang, I appreciate that. But where you specifically had told the public that there were no cases in northern Nova Scotia, it can't help but perhaps lull them into a false sense of security. It's the last remaining area of the province without a case. So if today's case is from the north, it would end any speculation in that regard.
Part of the reason we moved off that message is because of that risk. We're concerned about a false sense of security. We will get cases throughout the province as time rolls on.
Thank you. Next, we go to Timothy Gillespie from South Shore Today. Go ahead, Timothy.
This is for Dr. Strang. Dr. Strang, 2 weeks ago there was a very large conference, 15,000 attendees of dentists from throughout Canada and North America. There were 4 COVID-19 cases linked to that event, and Dr. Henry said in a press statement that there were other cases that they identified in other provinces. I'm wondering whether your department has, there were probably hundreds of dentists from Nova Scotia who attended that conference. Has your department made any effort to track the dentists that attended that conference and to ensure that they are monitored and tested?
So that was a large conference, but it was in Western Canada. We're not aware of any dentists from Nova Scotia attending that conference.
Thanks, Timothy. Do you have a follow-up?
Yes, I got a couple of reports today that at the Roseway Hospital here in Shelburne, an ambulance arrived and people in the outpatients waiting room were asked to exit the building immediately. Nobody has ever heard of that happening before. I'm wondering whether there was an incident, a COVID-19 incident at Roseway today.
Nothing's come my way. I don't get informed about all local level issues like that. My office is made aware when we have the people that are testing positive for COVID-19. The health authority has robust procedures in place for ensuring the safety of both patients and healthcare workers when somebody who's suspected of having COVID-19 comes in for testing, or if they come into the emergency room, as we said yesterday, when the case that needed to be hospitalized, appropriate infection control steps were taken from the moment that person was engaged by EHS all the way through till they were in the COVID unit in the Halifax Infirmary.
Thank you very much. That's all the time that we have today for questions. I will say, though, Premier, we are hearing from the line that we have declared a state of emergency, and I understand that's incorrect.
No, we have not. We continued under the public health order that Dr. Strang has been operating under for the last week. We monitor this every day as we go through the process. I want to thank all those Nova Scotians who have been working and following the instructions of public health, whether it's closing down their business or the fact that we've said if you've been out of Canada, you need to come home and self-isolate for 14 days. We thank you for continuing to do that. We encourage you to continue to follow the public hygiene practices that Dr. Strang and public health have talked about. It is absolutely critical. I've said this many times. I've said it as early as today in other outlets. This is within our own hands. It's not too much to ask for each of us, if we've been out of Canada, to spend 14 days at home. It's not too much to ask for all of us to wash our hands more frequently and show proper hygiene. And it's not too much to ask to show the proper distance when we're out in public working and around with other people, that if we've been out functioning, to show the 6 feet rule that Dr. Strang has been talking about. We will, though, continue to monitor whether or not we need to put any state of emergency, and that will be determined by whether or not there are other activities taking place in our province where people don't follow the rules that we've laid out. But I want to say to Nova Scotians, you have been. I also want to tell you, as we enter in this weekend, I want you to look around your community. If you know someone who's isolated, please pick up the phone and call them. You may not be able to see them physically, but that contact is important for them, their mental health, for the support. Whether you're a senior living at home, whether you're a single parent who's a day with your children at home, whatever the issue is, it's important that people have that contact with their neighbors and friends. And it's an act of generosity and kindness. And as we work our way through this, it's those acts that will make the biggest difference. We will have the appropriate health care in Nova Scotia. We have professionals who will deliver the appropriate health care. But those acts of generosity and kindness that we show towards one another will help those of us that are not in the healthcare system with the virus. It'll help us understand that we will get through this, and we're not in this alone, that we're in this together collectively as a province, and we can do this. So I want to wish you all a good weekend and look out for each other.
Thank you.